5 years ago today, do you remember where you were? The World Health Organization declared COVID-19 a global pandemic. It would take 3 more years on May 5th, 2023, for WHO officials to declare that COVID was no longer a global health emergency. As of March 6th, the Centers for Disease Control and Prevention says more than 1.2 million Americans have died from the virus. Vaccines have contributed to a decline in cases and deaths, but COVID-19's lasting effects will likely be here for years to come. CBS News digital reporter Alex Tin joins us now for more. I shiver a little bit thinking back to that time because it was so hard for so many people for so many reasons. What lessons have government and public health officials learned from the pandemic?
Yeah, look, some of the lessons that have been learned by government and public health officials aren't particularly exciting, but are pretty important. We saw major changes, for example, to the way the CDC is structured to address those things like that, the notorious COVID test failures that a lot of people remember from early during the pandemic. But some of the lessons learned, too, have translated to real, tangible effects to how health officials handle everyday so-called flu and other viruses all around the country. We saw some of that this past flu season where, health officials now can look day by day at essentially almost live data from emergency rooms and hospitals. That system was set up as a large part because of the lessons learned during the COVID pandemic. But also, they learned some hard lessons, especially around the limits around public health. And you've seen that manifest in some of the reticence that we've heard from public health officials, not just talking about, COVID vaccinations, but other vaccinations. There's a real caution, a real change to the tone that you hear from public health officials. And you've seen that play out, too, in the backlash that we've seen. Again, not just for COVID vaccine requirements, but other vaccine requirements for other vaccine-preventable diseases, including measles.
What are some of the underlying effects the pandemic had? I'm thinking of work from home policies. I'm thinking vaccine reticence.
Yeah, that's right. Look, there are so many, knock-on effects that we've seen from the COVID pandemic. One of the things that I often joke about with some of the other producers here on the health team is that there are all of these viruses and bacteria that disappeared during the COVID pandemic that have come roaring back. And we've seen all these quote unquote record years because of the way that the COVID pandemic affected all these other health issues that were essentially put on pause for a few years and then suddenly came back. But obviously, yes, there's been a major change, not just to the way that people think about viruses and germs and how would they prevent them, to the, the willingness for people when they go to the emergency room and the nurse says, at this time of year, we ask that you wear a mask. That is something that a lot of places didn't do before the COVID pandemic, but now do, especially around that winter virus season. But probably the biggest change is the way that the public health discourse has changed. Think not just about Health and Human Services Secretary Robert F. Kennedy Jr., but those people that they've picked to serve under him. FDA pick Dr. Marty Makary, the NIH pick Dr. Jay Bhattacharya. It's pretty unlikely that we would have seen them be as high profile as they are now, if not for the COVID pandemic. And it's probably a big reason why they were picked to serve in the roles they were now, because of the positions and the way they spoke out during the pandemic.
DOGE is implementing a lot of changes in federal agencies, including the ones focused on health. How could that affect the government's readiness and ability to handle potential future pandemics?
Yeah, to be clear, the core functionality at a lot of these agencies to respond to pandemics, those haven't been touched by these DOGE cuts. They've been pretty clear that things like the CDC's disease detectives or the way that they respond to outbreaks or the pandemic stockpile, those things weren't touched by the cuts, at least not so far. But there are some bigger, longer lasting programs that were cut, fellowships and contracts, those pipelines of new people coming into the public health profession, the kinds of programs that were designed to boost laboratory readiness, not just here in the United States and around the country, but also around the world. And then obviously the major cuts to things like, USAID and those other foreign aid contracts that were designed to boost readiness and the ability for not just the United States, but other countries to detect and respond to outbreaks. All of those programs were totally upended over those, these past few weeks because of those cuts. And there are real warnings now from public health experts that that is putting us less prepared, not more prepared, going into whatever the next pandemic might be.
And COVID taught us anything that's happening on the other side of the world doesn't mean that it's isolated to that. Alex Tin, thank you.